Hi everyone, it's Chandler Thoughts 555 and I'm here with another video. And in this video, I am going to present a mental health term of the day. And in this video, I'm going to speak about the term called affect. So affect is a term that is used in the mental health field by psychiatrists and other mental health professionals, possibly social workers. And this is typically used to describe your outward appearance that could potentially have a correlation with what your mood is for that day or while you're meeting with the psychiatrist. So, excuse me, I'm not going to provide a Webster dictionary, definition, but I'll do the best to get it as close as possible. I want to make sure that I'm using my own words to describe this term, and I'll provide an example afterwards. So, as you can see while I'm speaking, my affect could be kind of explained as outgoing, bubbly, happy. I don't think these are necessarily terms that a psychologist would use. They might use outgoing or some more psychological psychiatrists, bigger, broader terms that could be used to display somebody who seems to be in a positive mood. Or this could also be described as mania because I'm speaking fast. I could be moving around a lot. If somebody has bipolar disorder, a person that's speaking rapidly and overly exuberant could be described as someone who has the onset of mania. Now, look at this. So that could be described as a flat affect. And typically, with people that have schizophrenia, they could have a lack of emotions, an inability to express their feelings or outwardly show them. And this is, or even with people that are dealing with depression, they will not have a affect that will display what they will not have an affect that is positive, that results in mania or an affect that could be described as bubbly. But there's a difference between affect and mood because mood could be described as a person's internal emotional state, and affect is used to express a person's outwardly emotional state. So a mood could not necessarily be displayed always by a person's affect. So a person with affect like this, that could be viewed as flat, a little depressed, but internally their mood could be tranquil. They could feel happy. They could be thinking about something that is positive, and once when they share this with the psychologist or psychiatrist, they will have to rewrite, or rethink the whole scenario because the mood may not match what is being displayed outwardly. And another example could be a person that is crying or laughing a lot, and this could be viewed as a positive affect, but in reality, they could be laughing and crying a lot because they have extreme anxiety, and their anxiety during a meeting could cause them to show this anxiety through laughing and or crying hysterically. So, as we continue learning about mental health conditions, we all know that a person's onset with dementia, excuse me, not dementia, with depression can be misleading because there's symptoms of depression that are felt internally. A person can have an internal mood that is depressed, but outwardly they could be, like just as bright as me, somebody that's expressing themselves but probably not expressing their mood properly to let others aware of how they feel within themselves. So excuse me for getting my words jumbled up and tongue tied, but at least I could say in this video I gave my best personal presentation of what affect is in comparison to mood, and I gave a couple of examples. Please like, share, and comment below on how um, you feel about these terms, how you feel like they could be used in your day to day life. And let me know if there's any more questions you have and how I could better describe and provide examples of the two terms I provided today. So, thank you guys, and I'll see you soon. Bye.